Hello, gentlemen. If you're over 50, 60, or beyond, and you've noticed that your intimate moments have started to feel different specifically, if you experience that full, peak sensation of pleasure, but notice the absence of seminal fluid afterward, this message is for you. Maybe it happened just once and immediately sent a knot of worry to your stomach. Or perhaps it's been a recurring, silent issue you've been keeping to yourself, feeling a sense of confusion or a quiet fear about what it means for your health. First, take a deep breath. I'm Dr. Jocelyn. I've spent the last 5 years focusing on men's vital health, and I want to have a conversation with you that is serious, honest, but profoundly supportive. What you're experiencing is not a sign that your masculinity has expired. It isn't a failure. It's a message your body is sending you, and today we're going to decode that message together. Before we go further, we have to clear up one major misunderstanding that causes a lot of unnecessary anxiety. Climax and ejaculation are not the same thing. Climax is a neurological event. It's the sensation of intense pleasure governed by your brain and nervous system. Ejaculation is the physical, mechanical act of expelling fluid. Most of your life, they happen at the exact same time, so we think of them as one. But biologically, they are driven by separate engines. When you experience the pleasure, but not the fluid, we call it dry ejaculation. It doesn't mean you've lost your virility or your ability to enjoy life. It simply means a part of the plumbing has changed, and there is almost always a very specific, identifiable reason for it. In my years of practice, I've seen that the biggest hurdle for men isn't the physical change itself, it's the shame that stops them from seeking answers. My goal is to give you the clarity you need to move from worry to action. If you value this kind of direct, doctor-to-friend advice, please hit that like button. It helps this video reach other men who might be suffering in silence. And I'd love to know who I'm speaking with today. Where are you watching from? Drop your location in the comments. I'm always moved by how this community of men supports one another across the globe. Let's look at why the pipes might be behaving differently. Number 1. The gatekeeper is too relaxed retrograde ejaculation. The most common reason I see in my office is called retrograde ejaculation. The biology. Think of a small muscular valve, a gatekeeper at the exit of your bladder. During climax, this valve should clamp shut tight, ensuring fluid only goes one way, forward. If this valve is too relaxed, the fluid takes the path of least resistance and flows backward into the bladder instead. The practical clue. You might notice your urine looks a bit cloudy the next time you go to the bathroom. The cause. This often happens as a side effect of medications for high blood pressure or an enlarged prostate. It can also happen after certain surgeries. The machinery is fine, the traffic light is just stuck on green in the wrong direction. Number 2, the plumbing is blocked, duct obstruction. The biology, your body is likely producing the fluid normally, but the delivery pipes, the ducts are obstructed. The practical cause, this can be caused by old scarring from past infections, like prostatitis, or very rarely, tiny stones that form in the ducts. The emotion, some men feel a slight pressure or discomfort during climax when this happens. The good news, many of these blockages can be cleared with simple treatments or inflammation management. Number 3, the fuel is low hormonal factors. The biology. Testosterone is the primary fuel for the entire male reproductive system. It tells the prostate and seminal vesicles to produce fluid. If your fuel tank is low, the volume of fluid drops significantly. The practical sign. You might also notice a drop in desire, more fatigue, or less firm morning responses. This is often a treatable condition called hypogonadism. A simple blood test can tell us if your system just needs a refill. While most causes are manageable, I have to give you a red flag warning. If dry ejaculation happens suddenly and is accompanied by pain or blood in the urine, a sudden loss of sensation, fever, or pelvic pain, please see a urologist right away. These can be signals of a more serious neurological issue or an infection that needs urgent attention. So, what do we do from here? Here is your 3-step plan. Investigate, don't ignore. Schedule a checkup. A simple physical exam and a blood test can usually solve the mystery in one visit. Audit your meds. If you're on blood pressure or prostate medication, ask your doctor if a simple adjustment could fix the relaxed gatekeeper issue. Talk to your partner. Shame grows in the dark. Explaining that this is a mechanical plumbing issue and not a lack of attraction or virility lifts an incredible weight off both of you. I want to tell you about a patient of mine, a proud man in his late 60s who was devastated because he felt incomplete. Once we identified that his medication was causing retrograde ejaculation and he realized his ability to feel pleasure and connect with his wife was totally unchanged, his entire posture changed. He stood taller. He realized his masculinity wasn't measured in milliliters of fluid, but in his health and his presence. Gentlemen, your best years are not behind you. A change in your body is just an invitation to take better care of yourself. Don't let doubt or shame stop you from seeking the answers you deserve. Your vitality is about your connection to life and the people you love. If this video helped clear the fog for you, please share it with a brother or a friend. Let's break the silence together. Hit subscribe so you don't miss our next talk on staying strong and vital. Stay proactive, stay confident, and take care of yourself. I'm Dr. Jocelyn, and I'll see you in the next video.